I just pressed that. All right, it's now live. People are coming in. I'm just going to stream it to Facebook, and then we'll get started.
Welcome, everyone. We'll get started shortly. Thank you for joining us.
All right, the Facebook Live isn't working. That's okay. Let me share my screen, Katie, and then we should be good to go. Can you see it? Cool. All right, we'll get started in about a minute. Welcome, everyone. Hello, Bernadette, Sandra.
All right, I think we're going to go ahead and get started. Good afternoon, everyone, and welcome to today's Link Senior webinar. We are providing one free NAB, NCAP, and NCC-DP CEU credit today. In order to be eligible for the CEU credit, you do need to remain on this webinar for the full hour. The Zoom meeting room will track how long you remain in the room and will send that as a digital report to me. We are not able to provide CEUs to people who join only by phone. You must be logged into the Zoom room today. At the end of the webinar, I will provide the required post-webinar CEU survey evaluation link in the webinar room chat box. And it will also be sent by email this afternoon. Please be sure to check your email spam folder. If you don't receive the link this afternoon, please email me right away so that I can send the survey to you directly. You need to fill out that survey no later than midnight Eastern Time this Thursday, September 24th, to be eligible for the CEU credit. If you are not looking for CEU credit today, we still want your feedback, so please go ahead and fill out the short survey as well. CEU certificates will be issued by email on Monday, September 28th, next week. Again, please check your spam folder that day. You will also receive a PDF of today's slide deck presentation and a recording of the webinar by email later this afternoon. And now I will hand it over to Charles DeVille-Morn, CEO of Link Senior. Charles?
Hi, thanks, Megan. Good day, everyone. Good morning, good afternoon, good Tuesday, September 22nd. Feels kind of crazy to think that COVID started about 6 months ago, and I don't really remember what it was like before. But I want to pause, and as I often do, but it doesn't mean that it's not special nor important, I want to pause and just reflect and thank everybody on the line, every person that works in senior living, especially people that are showing up at work in a position of resident engagement, whether it's activities, life enrichment, wellness, rec therapist. You truly are heroes, and I know we've, a lot of people say that healthcare workers are heroes, but I think that you are special for a number of reasons beyond that, which is, COVID has really disrupted everything on Earth, what it means to be a human, a social animal, and so on. And we sometimes forget, well, anyway, probably myself, and I know people that forget that senior living, long-term care, is actually the industry, the sector that is the most challenged and disrupted by COVID, by far, right? So I think that is important in the sense that that really, really, really makes you special. And there's another reason also is prior to COVID, a lot of people were still hesitating on the importance of activities, right? And I think that as crazy, as bad, as challenging, as vast as the losses that we have, one of the silver lining is showing how important you are, right? You are more than essential, and I don't know the word more than essential, but you are more than essential to the industry, and probably more important, you're more than essential to the life of our older adults, right? We often forget, and I just want to say it, the pursuit of purpose, right, finding meaning every day, that is a basic human right, right? And you, in your position, are the enabler, and you are the fighter, the protector, the person guaranteeing that basic human rights to thousands, hundreds of thousands, and millions of people. So again, thank you for the work that you do. It is not forgotten, and we will get out of this much stronger. So thank you for taking the time to join us today. I'm Charles Villeneuve, the CEO and co-founder of Link Senior, and it's really with great deep pleasure that we're welcoming again Dr. Katy Abbott, Associate Professor at Miami University, who is really going to help us understand what we believe is kind of how you start, probably the most important, the foundational block of person-centered care, which is how do we understand the preferences of our residents. Now, in this time of COVID, it is really important that we consider how we use that, which is a very important asset of ours, right? How do we use that to combat isolation? So the title of today's presentation, which I'm really excited to be hearing in just a few minutes, is Stronger Together, Combating Isolation by Understanding Preferences. Before I get started, just a couple of things. One is we have a lot of people joining these webinars, which is great. The chat is very active. We can't monitor the chat for the questions and answers. So if you have any questions for Katy today, please drop them in the Q&A, and they will be answered during the presentation or at the end. Now, a little bit of background before we get started. So as some of you might know, we started this initiative around these webinars about more than 2.5 years ago, because we knew two things. One is there's a profound need for good quality education in the market, right, for people like you. We just kept on hearing about people that weren't allowed to get out of their community to find quality education. So that's really kind of in a way to help. But also, as importantly, or maybe even more importantly, something that we deeply believe is the better educated you are, right, the more tools you have, the better you'll be enabled to increase the quality of life of your residents, to engage them purposefully. And again, our end goal, all of us, is to do that, right? To promote purpose and meaning and improve the quality of life of our residents. So this is why we started, this is why we continue, and obviously this is why we've expanded this platform, in part because of COVID. We've been very lucky to have fantastic speakers, including the person here. You might recognize it's today's speaker that I welcome again. Katy's been, I think, on one or two of our webinars before. So it's a great pleasure to have you again, Katy. Thank you. Just a little bit about Link Senior, the company that I founded. We have a resident engagement platform for senior care to help people that work in IL, assisted living, memory care, and nursing homes do more in a way and use their passion, and in these days to fight isolation, really to promote resident engagement. We're very proud of the fact that we are the only platform in the market to have a research study that was published in a peer-reviewed journal, so we can proudly say that we are evidence-based. One of the things these days that is really important that everybody is trying to promote is social engagement. We've measured it, we know how to do it, and we would welcome the opportunity to show you how this could help you. You know, behind Link Senior is also two driving forces that are platforms and initiatives that we started. The old people are cool because we believe that they are like anyone else, and we love the idea of talking about age in a positive way, regardless of the age or where the person is. And we believe that ageism is probably one of the biggest problems in society today. And obviously, because of COVID, you might be very familiar with our Activities Strong initiative. So with that, please stay until the end. I have a couple super cool announcements to share about that. But these are the platform, and that is what drives us and why we get up in the morning. Today's presenter is, can I say you my friend, Katy? I'm joking. You, Katy is actually a friend of mine. We've been working together for years. Some of it we're excited to share today. I met Katy probably 3 or 4 years ago. She's a professor, an associate professor, sorry, at the University of Miami, and has been for a long time a promoter of person-centered care, but in a way that is completely, obviously, more than evidence-based, data-driven, and also actionable and measurable. A lot of the work, including PELI, is you just can't find the type of same quality elsewhere in terms of work. And we're very proud to partner with Katy and her team here. Myself, you probably heard about me before. If you haven't, the one thing I'd like you to remember is that I love old people, or the older adults, and I firmly believe that our industry is activity strong. So with that, just a couple words in the introduction to frame today's presentation, and then we'll get started. I think, I've talked enough about COVID. The one thing that I like to repeat, because I think it's important, this is one of our person that we work with that I have a lot of respect with. I think back in June, July, told me one thing that I thought was so cool, which is, COVID is there. We can decide to fight it if we want, which is, we have sometimes, but probably the most important is we have to understand how we're going to live with it, right? We cannot remove COVID from our communities. It's probably here to stay, or at least its impact are there to stay for some time. So I think it's really important to consider, how do we, human beings, understand how do we live with it, right? Besides our work in senior living, our offices right now are downtown DC. I'm in a completely empty office space, and it's been like that for 6 months, and will be like that until January probably. What does it mean, right? And I think that if we look at the way we operate in senior living, what does it mean to live with COVID and its impact? Just a few data points that makes me so proud of you, the audience, is this resilience and fantastic optimism, right? 93% of us believe that we will get out of this stronger. And I agree, obviously, and I would argue that if the question isn't if, the question is how, right? How we're going to do this, how we're going to partner together to make resident engagement stronger. Because we shouldn't forget that the reason why we signed up for this job, the reason it is that we do what we do, is we're here to collaborate with residents so that they can live every single day with purpose, right? This is what I said before in terms of the basic human rights, that you have the power, and every time you show up at work in the morning, this is what you enable. You enable these older adults to live with purpose. So with that, I'm going to turn it to Katy, and thank you, everyone. Please feel free to continue chatting or ask questions in the Q&A. Katy, it's all yours. Thank you.
Thank you. Can you hear me okay?
Absolutely.
Wonderful. So I'm just delighted to be here. Thank you all for showing up. I teach classes and we're all remote right now, and that's what I tell my students. I'm like, the most important thing is that you show up and you're here, and thank you all for that. And I agree, Charles and I connected because we had mutual interests and purposes, and it's wonderful to be able to collaborate with folks. And so what I want to tell you a little bit about is this idea of preference-based living. And so this is something that one of my colleagues, Kimberly Van Heitzma, and I have been working on for many years. And so what you're seeing in the sense, and I'm going to look over here so that I can see the slides, and so I apologize for not looking directly at you. But what we're going to talk about today is a little bit of the work that we've been doing around how to partner with providers and support you all. So we don't believe that it's just your responsibility to provide person-centered care. We believe that everybody should be committed to supporting our nursing homes, our assisted livings, our home care, our adult days with providing person-centered care. Everybody has a contribution they can make. And what we've been doing with providers is thinking through this plan of how do we develop a plan, how do we develop procedures and policies to allow for the sustainability of those plans? How do we formalize how our preferences are assessed? And how do we utilize that information to enhance care? Why don't we go to the next slide? And so one of the things that I also want to tell you about is that this is not just me. So the work that we've been doing has been a broad collaboration. And so Miami University and the Scripps Gerontology Center in Ohio, which you can kind of see a little, I've got my little picture in the background. So I'm not down in Florida. I know the University of Miami down in Florida, but I'm in Ohio. And we also have Kimberly Van Heitzma is a professor at Penn State. Obviously, Link Senior is a partner of ours. We also work with Tennessee Tech University and Abramson Senior Care. And so these are just a few of the major players. And so I'm going to be sharing with you some information today from Abramson Senior Care. Let's go to the next slide, please. So today what I'd like to do is I'd like to tell you a little case study about Abramson. And so I want to tell you about how their director of recreation shifted to providing one-to-one person-centered care when COVID hit. And I want to share with you how they were able to do that using Compass, which is a software platform that we've partnered with Link Senior on. And I also want to share with you how they use the information from these reports to drive their quality improvement. I'll share some resources with you, and then I'll have questions and answers we'll have time for. So let's go to the next slide, please. All right, so this is my worldview, if you will. And I wanted to share this with you, and we're going to come back to it at the end, because here's what we believe fundamentally, that if you're focused on individual resident preferences and being able to assess and honor those preferences, you are going to see that individuals are going to have greater satisfaction with the care. They're going to have greater well-being. You're going to see that ripple out into family and direct care workers, right? Where family are able to contribute meaningful insights if their loved one is unable to tell you about their preferences. We know that direct care workers are more satisfied knowing that they're providing care that meets resident preferences. We also know that caregivers have strategies to relieve communication of distress once they know somebody's preference. If I know you'd love to talk about the Apple Butter Festival and we need to take a bath, we're going to talk about the Apple Butter Festival and ease that transition. We know that it can ripple out to provider community goals. So this way, the voice of every resident or client is heard, that care delivery is aligned with the resident preferences. You're meeting regulatory mandates. You're able to retain staff. You're able to utilize the quality improvement techniques that you're mandated to report. You're going to see higher resident satisfaction, higher family satisfaction, and hopefully an improved workflow. And then finally, at the societal level, what we see is equity and efficiency. So by focusing on preferences, we can ensure that systems are in place for all individuals to have their preferences included in the plan of care. And we see that as increasing efficiency and directing resources to what matters most to residents and their caregivers. So let's go to the next slide, please. So now I'm going to talk to you a little bit about Tori. And so the next slide is all about March 2020 that Charles mentioned, right? And so everything changed, right? So Tori writes, the future of all healthcare practices drastically changed. The COVID pandemic has had a tremendous impact on healthcare and especially healthcare delivery for older adults. It's determined to be one of the most vulnerable populations. Extreme measures were taken at a rapid pace to ensure the safety of older adults receiving healthcare services, right? And we know that the biggest outbreak initially was in a nursing home in Washington State, right? Let's go to the next slide. And so Tori says, well, we'll just quarantine for 2 weeks, right? Like that was the first piece, is that the initial hope 6 months ago was that we just had to quarantine for 2 weeks. And we know that that's not the case, and it will not be the case moving forward, right? And so her perspective from the therapeutic recreation standpoint, rather than spending all day encouraging residents to come out of their rooms and join group programs or make their way to the dining room for meals, we were now doing everything we could to keep people 6 feet apart, ideally in their rooms without access to visitors. When Abramson experienced their first case of COVID, they restricted resident contact to nursing only. So they expected the nursing staff to pick up responsibility for resident engagement and activities, basic housekeeping, meal service, and this was completely unrealistic. It didn't last long, but oddly it highlighted the impact that everybody has on the residents' day-to-day lives and their preference fulfillment. Let's go on to the next slide, please. So Tori talks about how they have a laser focus on taking care of residents' physiological needs in the safest way possible. Nourishing their other needs has been extremely difficult during this time. She says there just aren't enough hours in the day to provide each resident with the one-to-one attention they need to reach that highest level of Maslow's hierarchy of need, right? That self-actualization, right? We're just focusing on that basic, on those bottom triangles. Let's go on to the next slide, please. And Tori explains that theories on wellness support that optimal health is achieved when all aspects of an individual are nourished. And so what we want to highlight is in the 6 dimensions of wellness here, preference-based living takes into account not just preferences for physical needs or comfort, but all of these domains in the 6 dimensions of wellness. Okay, let's go to the next slide. Okay, so then how did she do it? Right, how was she able to shift? And so Abramson is unique where they use the preferences for everyday living inventory to assess the recreation and leisure preferences of their residents. And they do this, so they had this documentation in place. And so when COVID, when the pandemic hit, when they were forced to isolate, Tori's community used the PELI to help translate each assessment into a short one-page assessment that could be made accessible for all staff. And this was something that was a big time saver. And so for the few days that the recreational staff were not included in the quarantine household staffing, she had this documentation present for the nurses to be able to understand somebody's preferences. And so again, what we're trying to do is provide documentation about what matters. So asking residents about their important preferences for activities and social contact can be one of these meaningful bedside activities that helps residents know that you're listening and care about their needs. So again, in this COVID environment, having a one-to-one activity to talk about their preferences was a meaningful activity, she found. And then the focus on meeting preferences that each resident can fulfill independently or with a team member's support was the next stage. So let's go on to the next slide. If you're not familiar with the preferences for everyday living inventory, we'll share resources at the end, but very briefly, this is an inventory that was developed over many years, and we did interviewing with older adults who are receiving home care and nursing home care, and we asked them about their preferences. And so there are 72 total items. Each item is a standalone item. They do not have to be used together as a whole scale. And what they do is they assess the importance of a range of preference domains. And you can see the domains on your slide. The MDS Section F that many nursing home providers are required to complete relied heavily on the PELI, and so 16 of the items that are in the MDS are also a part of the PELI. So you're probably familiar with some of those. How important is it for you to be around animals such as pets? How important is it for you to have snacks? So there's several questions there. And for quality improvement purposes, we have a 4-point scale from very important to not important at all that you'll see I'll explain in a minute. Let's go to the next slide, please. Okay, so Tori said that honoring preferences during quarantine, what she was able to do is that she was able to prepare materials to be used in the residents' rooms for solo activities. So crossword puzzles, art and craft supplies, audiobooks, favorite music for listening. I'm sure these are all things that you all have done, right? And she was able to look at her reports to emphasize activities that the data showed residents most enjoyed doing on their own, such as reading, watching a movie, and listening to music. And they were able to also offer discussion-based activities in place of activities where they would normally share supplies, since where they were not sharing supplies, right? So again, the resources that they were able to direct very quickly had to do with the data they had on individuals' preferences. And let's go to the next slide, please. And you'll see some examples that Tori wanted to share with everybody about how they developed a theme of the week, a theme for every few days. They hosted doorway games like bingo and trivia. These are all things I'm sure you guys have done too, right? And so just as a quick example, and then let's go to the next slide. So here's where social isolation is really taking the forefront, right? Visitors are not allowed in. And as Charles mentioned, we are social creatures. We thrive on the ability to be with one another. And so isolation does not do us well at all. And so looking for ways to overcome the risks to well-being that arise when people are isolated for safety was something that Tori and her staff tried very hard to do. They helped individuals set up regular schedules for phone calls or virtual visits with Skype or FaceTime. They also had a plan in advance so that staff could be present to help the residents use their phones or computers or other devices. And so again, one thing that this pandemic has required is for us to really move into the digital age and to learn to use these technologies. All right, let's go to the next slide. A couple other things that Tori did that I'm sure all of you were probably doing too is she asked residents if they wanted to modify their rooms for greater comfort or for in-room activities that may help relieve distress. So this is again one of the items from the PELI. How important is it for you to set up your room for comfort? And so if that's an important preference for somebody, this is an activity that could be done with them. They invited families to bring in photos or other comfort items if it was possible. And they also hosted support groups for residents who were cognitively capable to learn about the community's precautionary changes in daily routine and to share their concerns related to the restrictions on family visits and other topics. All right, let's go to the next slide. And you'll see some images of some things that they were able to transition outside for some activities when the weather came up. So here's what Tori wanted me to share. She said that, had we had all of this in paper and pencil format, it would have been very difficult for me to quickly compile it and figure out what I needed to do. So because they had this in an electronic system, she knew she could quickly pull up the data that she wanted. And so what I want to transition to now is talking to you can go to the next slide, Charles, please, is sort of telling you that we know that the problem is that collecting this preference information via paper and pencil is inefficient when we live in a digital world and we need the data right away, right? And so what I wanted to share with you next is that completing what we heard from many people in Ohio, at least, is that they were able to do assessments. They can assess people's preferences, no problem, but then the information goes in a drawer or a binder and it never gets looked at again. And maybe if lucky, it comes up at a quarterly care planning meeting or an annual review, but you're working hard to collect these data, but that information isn't working for you. So let's go to the next slide, and I want to share with you Compass 16. And this is one of the reasons why I am so delighted to be here and to be with Charles, is because we were able to secure grant funding to be able to have Link Senior be one of our subcontractors for the grant to help us develop this technology. I am a researcher. I am not a computer scientist. I do not know how to do this, and I don't want to learn. I don't want to know any more about how to develop software and usability tests. It hurts my head. I want to do research. So this is where our vital partners come into play who know how to do this. And so Compass stands for Care Preference Assessment of Satisfaction. It's a web-based application that we've actually been working for 6 years to develop. Now, I know, it's a long time. Again, researcher, not computer scientist. We have been working a lot with computer scientists, and these are the features that it allows you to do. It allows you a system to be able to assess the 16 MDS preferences and get some more detail. And I'll show you some screenshots in a minute. So it's not enough to just understand that that's important for somebody to be around animals such as pets. It's important to know that they're terrified of dogs and they really prefer rabbits and that they're allergic to cats, right? Without that level of detail, it doesn't matter that you know that it's important for them to be around animals, right? So what Compass does is it allows you to identify the importance level, and if it's an important preference, then you can include some of those details that can then be included in the plan of care. It allows you to track resident satisfaction. So once you go through and understand what's important to somebody, you can come back through a couple weeks later and say, okay, how are we doing? You said that it was important to be around animals such as pets. How are we doing? Are you satisfied that that preference is being met? And then you're able to get reports that help you identify opportunities to areas of success that you want to celebrate, and also areas for improvement. And then you can also, I'll share with you our PAL card creator module that allows you to share the important preference information across different departments, shifts, because we know communication of preferences is hard too. All right, let's go to the next slide. And I think we've got a screenshot. Okay, so this is what it looks like. So what you can see here is the first thing is that, again, as I mentioned, we've just, for this version, we've just used the 16 MDS preferences, but these can be good for anybody. And you don't have to be in a nursing home. This can be great for assisted living, home care. There's a lot of things here that is still beneficial. So it walks you through asking the questions. So you see how important is it for you to choose what clothes to wear. If it's not important to that individual, you simply move on to the next question. If it is important, what you see in on the right-hand side of your screen are the follow-up questions, right? So then what do you usually like to wear? What do you like to wear to sleep? Do you like to wear jewelry, carry a bag or a watch, right? So we need those details. All right, let's go to the next slide. And then what it prints out for you is a report at an individual level that gives you detail of what's an important preference for this individual, what are somewhat important, and what are maybe not important preferences or important but can't do. So those items that maybe it's important for them to volunteer, but they don't think there's any volunteer opportunities available to them. And so what could we do? Or from all of you in the activities world, how can you modify an activity in a strengths-based approach to allow that individual to be able to continue to do a preferred activity that maybe they can't do the way they used to. You know, you might have seen, you know, or you might have raised garden beds so people can garden while they're standing instead of having to bend over, right? Okay, so then, as I mentioned, this report can be helpful for the plan of care or to guide discussions. Let's go on to the next slide. Then once you go through the initial preference interview and you find out what's important, this is what I mentioned to you about satisfaction. Then you can circle back and you can say, okay, well, how satisfied are you with this preference being met? And that information allows us to identify for people who can communicate this to us. Obviously, we recognize that not everybody is able to communicate, but for people who are able to communicate, it helps give us some data. So let's go on to the next slide, and you're going to see the report that it generates. So now you're seeing a pie chart here. The green are areas where the individual said this is an important preference, and I'm satisfied. So you celebrate those, right? So they're satisfied with having snacks. Woohoo, that's awesome, right? The yellow are areas where it's an important preference, but they're only somewhat satisfied with that preference being fulfilled. And the red is an area where it's an important preference and they're not at all satisfied. So again, this system highlights some of these for you. And you can do a little drop down and you can see, all right, what's going on here? We see that, that we've got some areas where Ruthie is not satisfied with her care. What could we do to make her more satisfied, right? Again, instead of just guessing or hearing something, you're actually using some data to make those decisions. And again, don't forget to celebrate the success. Let's go to the next slide. The system also creates a similar diagram at the neighborhood level. That's kind of the person-centered term. The older term, the term we don't use as much is the unit level or the wing level, right? So if you have neighborhoods like at Abramson, residents are grouped into neighborhoods of about 30 residents each. And so it might be useful, for example, if you have a look at that neighborhood. How is that neighborhood doing? At Abramson, they're able to have one activities professional assigned to each neighborhood. And so they're able to look across neighborhoods and see, how are we benchmarking? Do we see similar amounts of red, green, yellow? And the gray that you see on this report is the important but can't do. And so this is another aspect of that report system in Compass. Let's go to the next slide. Now here's my favorite part. So one of the things that we've been working with providers on doing is trying to figure out easy ways to communicate preferences. And what you see here are examples of PAL cards, or preference for activity and leisure cards. And these are short, small little 5x7 cards that can be attached to someone's walker or wheelchair. Some communities chose to have it all in one location on a bulletin board. Some communities wanted it on the inside of the room door or on the bathroom door so people could read it. There's lots of ways you can use these cards, but it helps get away from having the information in a binder on a shelf or in an electronic medical record that maybe people don't have access to. Maybe your volunteers, if you're able to have volunteers come in anymore, are able to come through and start a conversation with Sue because they see the card. All right, so the exciting thing with these, and so what you can kind of see here is on the front side of the card, it has a short biography, and on the back side, there's space for 6 important preferences. And these are things that, you know, probably made the person light up when you were talking to them. Let's go to the next slide. Here is what the PAL card editor looks like in Compass. So what you're able to do is, as you're going through Compass, you can star questions that you think are appropriate for a PAL card, and then you're able to drag and drop these into the PAL card. And so you can rename, you can type things in, and there's the text box for you to type in the resident bio. And let's go to the next slide. And then, ta-da, you're able to create and print a PAL card for that individual. Some people print them out on an 8.5 by 11 piece of paper and just use the whole thing up on a wall. Some people then fold it and laminate it so that it can be reused. And so this is something that we have had a lot of success doing quality improvement projects, both in the state of Ohio and the state of Tennessee. Especially we were doing this project in Tennessee when COVID hit, and providers said to us, this saved us. We live by the PELI. This really helped us pivot to the ability to be able to keep what matters most in front of the resident. Okay, so let's go to the next slide, please. So I've probably explained a lot of reasons why you'd want to use Compass, but here's a few more. So it's compatible with a variety of devices. You can use it on your phone, on a tablet, on a laptop, on a desktop. It's customizable to meet community needs. We have the open text fields for you to record any details that are important to your clients, your residents. It provides easy to interpret visual reports, those pie charts. We try to make really simple so that you can see and celebrate the green and see the red and understand what you needed to do. And the things that we are so excited about is that it maximizes data that you're already collecting, right? You're already doing 90% of the work here. With just a little bit more effort, you're able to enhance a data-driven decision-making capability. And that's what we wanted to capitalize on. All right, let's go to the next slide. So how do you access Compass? It's available now. And I hope, and maybe Megan, if you can drop that link into the chat box for everybody to see. So it's available now. And what we're doing is we're doing monthly demos. And so one of the things that I wanted to say is that the grant support, we've received generous grant support from the Ohio Department of Medicaid and the Tennessee Department of Health to help develop Compass. And so again, because we've developed this with grant funding, it is available to you at no cost through Link Senior. And that is something we're very proud of. We don't think this should just be available to the communities with resources. We want this system to be available to every community, every provider out there. Okay, so now I want to go back to Abramson, and I want to talk to you about how they use this preference information in their quality improvement strategy. So let's go to the next slide, please. So here's an image of Abramson. I worked there.
Katy, just one question, because people were asking about the cost of the program.
Yes. So the Compass 16 is available at no cost because we've had such generous grant funding. We could only do this because the Ohio Department of Medicaid and the Tennessee Department of Health believed in the work that we were doing. And when we submitted grants, they funded us to do this work and develop this work. So Compass 16 is available at no cost. And again, we feel very strongly in the social justice component of this because it shouldn't only be available to communities. that have resources. We want everyone to have this in their hands. Any other questions before I keep going?
I keep them for the end. It's just that I thought that, yeah, a lot of people were asking for the cost, so it's free. Thanks.
That's like the best answer, right? Now, I do want to say one thing, is that we have had people think that free means it's not valuable. And we could charge a lot of money for this. Let me tell you, there's a lot of research, there's a lot of work and evidence that has gone into this, as I mentioned, for many, many years. But because we're so committed to this industry, because we believe we have a role to play in helping people receive high quality person-centered care, this was extremely important to us that we made this available at no cost. Okay, so this is a picture of Abramson, where I used to work for a few years. And so again, I want to share with you kind of the real life example about how Abramson was able to continue to provide excellent quality of care throughout the pandemic. And it's because their organization embraced thinking about their care delivery model. So they have what they call a systems level approach to person-centered care. And for them, it provides strength in times of crisis because staff have been allocated the time to learn what is most important to their residents, and they're able to quickly adapt their programming to respond to updates from emerging healthcare policies and regulations. Let's go on to the next slide. So I'm coming back to this original diagram that I showed you to illustrate how this person-centered system of care benefits key stakeholders. Again, what I talked you through this in the beginning, but Abramson uses this because, again, they see it as, first and foremost, residents benefit because their important preferences are incorporated into their plan of care and their choices are respected. Workflow processes in the organization ensure that all interviews are completed in a timely and if the resident in a timely manner, and if a resident is not able to participate in an interview, they are able to incorporate family input or staff input through observations. And this information can also help inform ways of helping individuals if they're communicating distress. Some people call these behaviors, right? And we think of them as a communication of distress. On a provider level, organizations benefit for many reasons, as I mentioned, meeting regulatory mandates, increasing cultural competency, and increasing resident and family satisfaction. So again, this kind of approach helps provide mutual benefit to all key stakeholders. Let's go on to the next slide. One of the things that has helped guide our work is the Institute for Healthcare Improvement. It's a nonprofit organization dedicated to improving healthcare. Their work helps organizations to envision why they would want to embrace a systems level approach to improving quality of care. And there are three key questions that guide thinking around this. And so the first question, why, what are we trying to accomplish? And so Abramson wanted to develop a systemic approach to asking about preferences and choices and how their residents would like to live their life in their nursing home. How would they know change is an improvement? They wanted to have positive outcomes to attain or maintain the residents' well-being and quality of life. And finally, what change can they make that will result in improvement? We wanted to be able to demonstrate that we are providing person-centered care, services, and care for our residents. So that's what drove Abramson in terms of their work that they were doing. Let's go on to the next slide, please. Here is what they did to what I would call operationalize that work, right? So the goals related to their person-centered care system encompassed those IHI guiding principles for performance improvement, such as effectiveness and timeliness, equity, and justice. So they had training, right? So training ensures that the staff are competent in how to administer an effective interview. So they help train staff on how do you ask about a resident's preferences. They set up the time for optimal interview times, right? So knowing when somebody's going to be most willing to share information, recognizing signs of discomfort, thinking about the interview to develop a trusting relationship, not looking at it as a task, but a way to develop that relationship. Then in terms of the PELI assessment administration, they established protocol for administering the PELI. So for example, they have a section of the PELI that's included in the move-in packet for family to complete prior to their loved one moving in. And upon move-in, the relevant departments ask select questions from the PELI. So the questions that the family completes helps the nursing staff with settling in the resident as they transition to the nursing home setting. And they also seek out family support when the resident is not able to complete the PELI, as I mentioned earlier. And they've established these workflow processes. The next part, the care planning and communication. So the PELI assessment drives their person-centered care planning, which incorporates preferences and interests. It's a key practice standard in the regulatory language for holistic well-being, such as trauma-informed care, dementia care, emotional well-being, and the PELI is how they, quote, mine out those gems that inform our care planning process, end quote. So it helps transform what they think of as a cookie-cutter approach to a thoughtful and meaningful crafting of intervention and goals. They have also developed some audit tools to assist their team with evaluating the care plan. The program delivery, so they leverage aggregate PELI data to establish recreational programming goals, services, and offerings. So commonly held preferences inform their calendar of events. So again, they're using data to inform the calendar of events. In turn, this helps with resource allocation, right? The beauty is that we know also who to invite because we know what type of activity is important to that individual. And then finally, the evaluation and outcomes, right? Their clinical performance improvement projects benefit from readily available preference information. So for example, at Abramson, their restorative nursing program had a lot of people refusing the restorative nursing program. They were able to tell the restorative nursing folks about some individuals' preferences who were refusing a lot, and they were able to get them to engage and not refuse those restorative nursing practices. So a system of care requires ongoing monitoring to ensure that there's continual maintenance of system goals with the ebb and flow of residential population. And so they check regularly to ensure that they're up to date with PELI assessments being collected. Let's go on to the next slide, please. I'm almost done here. This is some data from Abramson, what they call their quarterly preference match report. And this is an example of their real-time product from their person-centered care system. And the purpose of showing you their 3-month report over the height of the COVID epidemic is to illustrate how they were quickly able to adapt their person-centered programming to meet the CDC guidelines. And yet they also were able to maintain their internal benchmarks for optimal care. There's great value for any organization to have data-driven tools that position teams with problem-solving capacity. Their recreation team reviewed commonly held preferences and brainstormed how to meet those preferences in a new format. And so they were able to continue with their documentation of activities provided to their residents throughout this piece. So the logic of the calculations is from 2 data sources. So first is the resident important preference information, and 2 is the daily documentation of activities attended. So what you can see here are the percentages of people who attended a preferred activity, and you can see that by month, right? So for example, meeting the preference of exercise may include balloon toss, chair yoga, or arm exercises. Meeting the preference of music may include listening to the harp, a calming song sang in time of distress, or jamming to favorite music selections outdoors. The percentages reflect how many residents had their preferences met in any given month. And so, for example, of residents that indicate being with families is important over the 3-month period, they met that at a rate of 66% and gradually increased our rate as they were able to ease their quarantine. For example, as I mentioned in June, they were able to include window visits for all residents. So let's go to the next slide. And so, in conclusion, as I wrap things up here, to help you determine if a person-centered program such as Compass is a right fit for your organization, there's some things listed in this table that are key components of a measurement plan and resulting benefits from having that type of information. So there are 3 key measurement areas that require tools to assist with both process and outcome measures. With Compass, you'll find easy to use tools to assist you with a data-driven approach to person-centered care. It's going to equip your teams with the ability to make these data-driven decisions based on the needs and preferences of your resident population. And so let's go on to the next slide, and I want to share with you a little bit about what we're thinking in terms of the plan. If you're interested in using Compass, these are some of the things that we've been thinking about and working with other providers, is that thinking about planning, spending 1 to 2 hours, is Compass right for you? Setting some goals for Compass, and then implementing it and identifying those preferences and communicating those preferences through the PAL cards. So think about that kind of maybe the beginning, the 0 to 45 days. And then evaluating that. The system allows you to evaluate. You can measure satisfaction. You can review these reports. And then after about 60 days, you can decide if a pilot effort, for example, if you try this with 10 or 15 residents, if it's something that you want to continue or not. So again, this allows you the best opportunity to see if this is a system that'll work for you. And again, at 60 plus days, you can decide to direct your resources to what matters most. Let's go on to the next slide, please. So again, there's 3 P's that we wanted to impart. So obviously the purpose provides focus and clarity in your vision to provide the best quality care to the individuals that you serve. It defines your passion to seeking out ways to honor and respect your resident population. It values knowledge about preferences as the cornerstone of person-centered care. Power equips your team with the tools and the roadmap, really, and tools to effectuate your purpose, and Promise gives you the strength and courage to know that the results will be valuable and, although sometimes not immediate, are worth your effort. So let's go on to the next slide, and there's some resources here, and then I'm gonna be quiet. So where to find more information? Our website is preference-based-living.com, and on the website you can find our PELI questionnaires. You can find training videos. There's a 20-minute training video on how to do a PELI interview. So for example, if you've got some individuals who might be able to do virtual interviews with folks, you could set up a Zoom call so that you could have a volunteer maybe call and do an interview over Zoom with that individual if they're able to do that. We've got tip sheets, and we also have PAL card materials for you. One thing I also wanted to call your attention to is we're doing a free demo, a 30-minute demo of Compass on Wednesday, October 7th at 3:30 Eastern Time. There's a link here that will drop into the chat if you want to sign up for that demo. We just had one last week. And so, but one thing that I also want to mention is that we're available for you guys. We want to help you succeed. And so you're absolutely welcome to connect with us. Let's go to the next slide. And to connect on us, we have fabulous undergraduates who do our social media for us, and they post every day. So please follow us on our social media. We're on Facebook and Twitter. You can subscribe to our monthly newsletter. We don't share your information with anybody, and we send only information that we think would be valuable from a preference-based, person-centered care perspective. And again, it's just once a month. I can't do any more than that. And then partner with us too. Wherever you are, we have been successful in doing civil money penalty grants with providers around quality improvement projects, but we can do the grant part, but we need you as the providers to partner with us. We can't get the money unless we have providers in the state who are willing to do this. And so reach out, let us know. If you think that your state is ripe for this, that you've got 12 providers in the state who might be willing to do this, we'd love to work with you and to do virtual coaching to help do this project with you around PAL cards, around assessing preferences. Okay, and let's go to the next slide. I think that's it. I just want to thank you guys for all your great attention. I know it's a lot to absorb. I know I talk fast. My students tell me that all the time. So just know that we're here. We appreciate all you do. We want to support you. We want you to know that we've got your back.
Thanks so much, Katie. I was busy the whole webinar answering questions in the Q&A, so hopefully that was helpful. A couple ones that I just wanted to get your insight is, obviously MDS is for a lot of people we hear MDS and we think nursing home. Talk to us about beyond, like memory care, assisted living, and why would we use that beyond nursing homes?
Great. So there's a couple of ways I want to answer that. One is that Compass right now only has the 16 MDS because we had to start somewhere. We had to get off the ground. The 72 was too overwhelming. And even the providers that we worked with said they couldn't assess all 72 preferences. And that was never the intention of the PELI. We have some providers who say, you know, our satisfaction with meals is really poor. There's 6 questions in the PELI that focus on meals and snacks, when and where to eat, what to eat. You could just do a small quality improvement project around 6 PELI items if you wanted to. Now, obviously, to do something that targeted, you couldn't use Compass. But let's say, for example, if you wanted to use Compass, you could focus on the 8 recreational items in Compass and just try to improve how are you honoring those preferences. There's also personal care preferences. Now, we don't have yet a PAL card for personal care preferences because we're still working out how do we protect privacy. What we've talked about with compliance officers, HIPAA compliance officers, is that preferences are not protected health information. But there is an issue around dignity that somebody might not want this information shared. And so we need to do it with the consent of the individual or their family member. We need to figure out how to display this information in a way that's still respectful. Let me stop there.
No, this is great. You just answered 2 other questions in the meantime, so that's great. How long does it take to do it, to administer it on average?
So if we're thinking just the 16 items, I would say that if it's the first initial interview with somebody, it may take you 20 to 30 minutes. If you're doing more items, obviously it's going to take a little bit longer. In Ohio, for a couple of years, the full PELI, all 72 items, were included in a pay-for-performance mandate. And when it was the full 72 items, providers were telling us it was taking an hour to get through the whole assessment. And again, that's a lot. We don't recommend that. We'd recommend just a small pilot effort. Think about what fits your mission. Maybe you want to focus around social engagement and just there's 13 questions about socialization and social contact that you could focus on. So again, we're happy to talk to you all about this. We can have, one-to-one little consults and help you think through what your options are with this, because we know we can't answer all the questions right now.
Yeah, thanks, Katie. Thank you so much, Katie, for such a fantastic presentation. Everyone, here's my advice: is to take Katie's offer. Right? It will cost you nothing to have a conversation. We all know that social isolation is the biggest issue right now, and all of us should consider how we are gathering the preferences of our residents, regardless of the level of care, how we're gathering it, and then what do we do with it. I can tell you that most providers we talk to, they gather it, and unfortunately, they just sit there. They're not being used. And trust us, because we've analyzed, there is no better way to implement a process that is actionable and interdisciplinary than the work of Katy around the PELI and the Compass tool, right? Like Katy said, it will continue to evolve, but the invitation here is just to have a conversation and to consider a pilot. The other thing that Katy said, but I just want to repeat it, it is free for one good reason, is that CMS believes strongly in the initiative and therefore funded this development work. It is the highest quality and evidence-based mechanism to allow you to use that data to, again, accomplish person-centered care in an actionable way where you and your team can partner. And on top of it, there's the power card, which I think is really, really cool. So Katy, thank you for that. Everyone, please consider that invitation. Talk about it with your supervisor, your team. We're extremely proud of this partnership because, in the end, preferences matters. It is how you start res engagement, and this is by far one of the best mechanisms to do that. So thank you, Katy.
Thank you. And I'll just say that I know that there's some more questions. We'll try and answer these, and maybe we can send out a follow-up email to those people who attended with some of the questions to these, because we do plan to have EMR integration down the road. We've got some resources for balancing preferences and safety. So we'll try and put a little document together to share with you.
Yeah, so I couldn't go to all the questions, but all of these questions could be answered super fast like this, or if you want, feel free to send me an email or Katie. Thanks. I just have a couple of announcements. One is, backtracking a little bit. I want to. It was shared yesterday, and it's an exclusive news, and I'm super excited. Link Senior has entered a partnership with Activity Connection, and I'm excited for two reasons. When I started Link Senior, one of my very first mentor was Nancy Ewald, who's the co-founder of Activity Connection. And I flew with my co-founder to her house, and we spent a whole day with her, and she actually helped us design some of our very initial products. So I love that story, but I'm also super excited because Activity Connection is the most successful company out there to support activity directors. And so we're partnering with them that if you're a subscriber to Activity Connection, you can have like a discount on some of our offering, and we're looking to amplify the work in Activity Connection using Link Senior. So that's super exciting. The second thing I wanted, so it's released, and if you are an Activity Connection subscriber, feel free to go into Activity Connection. You'll see this landing page where you can find all the information if you want to consider this. The second thing, I want to thank everyone who's been to one of our open demos. We had a lot of requests of people asking, how can we easily find out about Link Senior? And so we enable this where we do open demo. It's free, it's short, it's 30 minutes to the point. And as everyone's going through COVID, I would encourage you to consider just spending 30 minutes to find out, is Link Senior right for your community, and can it accomplish some of the goals and overcome some of the challenges that you currently have. The third one I want to mention is, as you might have seen, we introduced the first of its kind, and actually Katie and her team participated in building this and contributing it. If you go to activitystrong.com, you will find a tab here for rights, which is a way to assess how good your resident engagement effort is, and the idea is to use that as an internal tool to understand how you can improve, right? So the whole idea is just to measure where you are so we can start improving as an organization. And then the final one is that we, as some of you were on our Activity Strong gathering last week, I would strongly encourage you that you consider joining us on December 1st. It's going to be very exciting. And last but not least, to help you fight and start to understand how to live with COVID, we've doubled down on our webinar opportunities. It will be difficult to be as good as Katie today, but hopefully some of these will be useful for you. One quick thought here, this person here will be our first speaker really going into physical and exercise, because we know today, because of COVID, because of isolation, it's a big issue. Karen Love will likely have a few people living with dementia join us. And on November 3rd, as we did back in July, we will be highlighting some of our successful clients. So, Katie, again, thank you so much for participating today. Given the comment, I think you were very helpful, and it's an honor to partner with you. And everyone else on the line, thank you for the work that you do. There is a light at the end of the tunnel. We just got to keep moving and partnering and figuring this together. Have a wonderful afternoon and a great end of your week. Take care, everyone. Thanks, Katie.
Go ahead and end the recording, Charles. Thanks.
Sure. Thanks, Katie. I did. You probably saw me focused on during the webinar. I was